started being ill with what I thought was a urine infection, was referred to my own GP, had about quite a lot of course of antibiotics, so then I was eventually referred to Bolton Hospital Urology, Bolton. Had a stent put in first procedure, which he couldn't get through properly. Then I was referred again for a second stent, which he did manage to get through, he said. Took a biopsy. I was told a week later that I had cancer. I was being referred to Salford. I was seen in Bolton 1 by the surgeon, told I would be having robotic surgery. A couple of weeks later, I was admitted to Salford for the operation. Before surgery, I came down to Salford to have my pre-op and met Jane. It was, I was told what the procedure would be. Then I went into surgery. I think I was down about 4 hours. When I came round, wasn't sure. I asked had I had the operation. And I was taken onto the ward. I think given drinks and food, monitored all night. Then in the morning, the physio came to me and said, "We're going to try and get you out of bed," which they did. They got me in the chair. I didn't even realise I had a catheter on. And then you just monitored. And then they came back to me and said, "Hey, we're going to try and get you walk up some stairs with help, and you're probably going home." So I did that, and then they said, I think I had a blood test done. They said to make sure everything was all right, and it went well. I think I was sent home about 7 o'clock with all the instructions of what we had to do, injections for a month and catheter on 2 weeks. We were sent home with all we needed, and then just sent home to recover. I didn't really know anything about it, but I think I've been in so much pain, I weren't really bothered how they got rid of it. But when the consultant explained it would be only small cuts, and he explained that, and I would recover a lot quicker, I was just happy to go along with it, just to start feeling better. Well, I wasn't expecting to come home so quickly, and my partner said, "I can't believe you're coming home. Have you asked to come home?" And I said, "No." But when I got home, because you've been at home, I was in my own bed, I just felt as though I was recovering all right. Probably after the first week, I knew I didn't need help going up and down stairs. I could do that myself. And I didn't feel as if somebody needed to be in the house with me all day. I was all right with that, just pottering about, going in the garden. Even though I was scared myself and I was told I was having it, definitely have it done, I just couldn't believe how quickly I've got back to normal and just feel as if my life can carry on.
Hi, so my name's Jane. I'm the Enhanced Recovery Specialist Nurse for Urology at Salford and have been so for over a decade. Over my time here, I have noticed the change in open, laparoscopic and robotic surgery. Robotic surgery for me allows me to do my job better. It allows me to encourage the patient to mobilise, to take diet and fluids, and the process in itself reduces pain. The pain is managed better by robotic surgery, which allows, in general, a safer journey and a better experience for all my patients, allowing a shorter length of stay when safe.